I've addressed the idea of lengthening the neck, keeping the neck free in dancing in some of my other videos where we talked about the Alexander technique. The idea of the core movement being the movement of the spine and head relationship, that the head leads the spine in vertebrates. But we haven't dealt with people who maybe have a severe issue with the neck. Forward and down like this, or the problem I have with many of my students who are trying to sense what it means to have the head up and then putting the chin up. We've discussed this before, that the chin going too high compresses the neck and actually puts the head down. Now, of course, there are movements where we might go into a full extension, and in that case what we want to learn how to do is to lengthen and then extend. Most of the movements that we do in dancing, though, we will also turn our head to the side as we do that. But we're not going to address those extreme extensions, but simply how you can strengthen the neck, because the Alexander technique is very helpful in learning how to move with ease. But if you've already got the body in a chronically down condition, pinched neck, and if the muscles in the back here are overdeveloped to help to balance that forward neck, and the chest area is compressed, then we will probably need some help in opening up the fascia, or the connective tissue, tightening it somewhat in the back, learning the sensation of sliding upwards, lengthening those extenders. We may need more than to simply think neck free, think of leading with the head. It's not a very physical feeling, it's a thought. But as I said, if the muscularity is extremely bound down in bad positions, then we have to do some extra work. So today we're just going to do some simple exercise that can be done against the wall or on the floor to help find which muscles to use to help to lengthen the neck, lift the head up, and connect it to the torso. We often have this picture of the neck from the chin to the shoulder line, as if it's cut off there. But if we were to trace down the muscular connections down to find our collarbone, in the front our neck muscles connect along the collarbone here. But in the back, muscles that attach up here to the skull go down into our rib cage area. So we're not going to say the neck is only to here, because the muscles are in the torso as well. So in order to lengthen out the neck and get the torso strong enough to support that head weight when we're dancing, and particularly when we're doing ballroom dancing, and for the ladies we have to also create an extension without getting this ugly compressed feeling in our neck. The other thing that does is it shuts off our ability to take in air when we compress there. So we want the long neck, and we want to feel that the neck is being supported through the trunk muscles, and particularly through the back. So we've also talked in some of our other videos about pressing out that thoracic curve, which helps us in lifting the head up. But if I had chronically compressed muscles there, I would not be able to do that. I have to do something to change the construction a little bit. So I like to do it in the car. If you put your head against the headrest and try to slide up the back of the neck and try to feel the muscles tightening. We'll take a look at the trapezius muscle, the big triangle muscle that's attached also to the back of the head, fans out and goes down well into the thoracic area. The trapezius is also part of that muscular structure. So when I lengthen up through the back, you can imagine that you have a ponytail there and you're pulling the head up from the back. You can also feel that I'm pressing out the thoracic curve. Sometimes a dance coach may tell someone to pull their chin in, like this. Now, the thing we're trying to do there is we're trying to get the extenders in the back to work. Because we're humans and we stand upright, gravity tends to pull us this way. So we have to be more mindful about lengthening upward and working against gravity and using those extenders this way. So when we nod, the chin will drop down. Depending on the shape of your jaw may be angled towards the floor or it may be level. When you start getting more and more and more tilt, again, I can do that in length or I can do that in compression. But when we're looking at ballroom dancing, we want that conversational position of our chin, level head, and then we want to create rotation and a curve coming through the thoracic area and up through the neck. And we have the ability to do slightly more articulation at those top joints, but we don't want this. So what we're going to do is lie on the floor and try to feel the lengthening back here. So I will feel my chin comes in somewhat and drops, but if I push the chin back, then I'm going into another tension pattern. So that's not what I want. Now, doing the exercises, you could say, well, I'm using more tension now than I might be when I'm dancing, trying to tone those muscles and retrain them. So when you're dancing, if you're not doing some extra work on the side to correct this forward head posture, and you're dancing in a position like that, you're just reinforcing the problem. And in this position, my shoulders are going to creep up to try to protect me there. For myself, I have a little bit of a reverse curve in the neck. The neck should have a slight curve in it. But if you've had neck injury or head injury, sometimes we end up having a slight curve in the opposite direction. So I do these exercises in the car every day. I can discipline myself to do 15 or 20 of these lengthening and holding. Again, still trying to keep the feeling of freedom here and not pulling the chin back and tightening it. So I'm going to use a pillow and show you how you might do this on the floor and use gravity to help you. This pillow is designed to have a place for your head and to support the natural cervical curve. And so if you have a reverse curve in your neck or a lot of forward head posture, you may find this helpful to sleep or to lie on it when you're watching television. So I'm going to use this. So my neck is supported by the little bump in the pillow and then the head rests down. I'm going to keep my feet on the floor and I am going to push also with my feet. We want the feeling of integration of neck, head, spine, and groundedness. So I'm going to push in with my heels, try to push myself up and feel as though I'm sliding the back of my head this way and squeezing my shoulder blades towards each other into a V and hold it. I don't feel that I have a lot of extra tension in my chin and relax. Again, press the heels into the floor. If you want to get a full integration here, feel also the pelvic floor muscles contracting. So you pull your sit bones together, press against the floor, pull the tummy up, slide the back of your head up into the pillow, and let the chin drop slightly inward. Make sure you're breathing and relax. Press the heels into the floor, engage the pelvic floor, lengthen the spine by sliding the head up. Again, make sure you're breathing, and again, press the heels, pelvic floor muscles, feel the back of the leg, slide the head, and relax. If you don't use a pillow, you may find yourself on the floor with your head in that position. And it's not normal because of the shape of our head that we would feel our neck resting flat against the floor. So the pillow can put you into a more natural, supported position for those curves. Then if you get yourself into that lengthening position, turn your head. Make sure that your neck muscles are not overly tight. If you have a lot of neck pain and you've tried everything, which I've been down that route myself, I had several traumatic injuries to my head and neck when I was a teenager and developed some chronic problems then with dancing, especially with ballroom dancing, where students take a long time to learn how to use their center to help to put us in a comfortable position and to give us the space that we need. So many lady teachers will develop neck problems dancing with their students. And if you're an amateur couple, and as your male partner learns to give you the space, you're trying to create a nice line, if the man is too tight, you're just going to hurt yourself. So this is a process of learning, obviously, correct technique of centering with our partner and creating space and not holding a completely rigid frame. The frame has to breathe. So there are bigger issues there, and of course using the head properly in relation to the spine. But one of the best things for my neck was to make sure I had the right pillow. And I say pillow because I had a habit of using 2 pillows at night, which means that if I were to lay on my back, that my head was propped up in a nasty position, and if I laid sideways, my neck was twisted as well. And I don't know why it didn't dawn on me or any of my doctors, but when I finally realized I needed to go to one pillow or go to a pillow with a little hole in it, that helped more than any of the treatments that I had on my neck. And of course, those of you that do pro-am, we always have that issue with our students. So the best advice I can give there is make sure you don't advance your students too quickly in the material that they're doing. Sometimes we want them to do more advanced things too quickly and they don't have the skill, they don't have the balance, their base isn't strong enough, they don't understand the So be patient with your students, and we have the syllabus for a reason to hopefully develop those skills before you start doing a lot of advanced work. I know everyone wants to do pivots and everyone wants to do oversways. Okay, now and then for a showcase, but you can get yourself in trouble and you can end up injuring yourself. So take care of your neck, strengthen your neck, and do your homework.